Earlier this week, we shared that there could be delays in the expected rollout of this fall's updated COVID-19 vaccine because of additional clinical trial requirements implemented by the U.S. Department of Health and Human Services. Now we're learning that many people will not be eligible to receive COVID-19 vaccinations altogether. The details are still unclear, but the FDA releases new guidelines limiting who can receive those vaccinations based on health and age. News Center Maine's Raya Wooten shares more.
I am pro-safety.
Under Robert F. Kennedy Jr.'s leadership, the Food and Drug Administration appears to be in for significant changes.
I am quite concerned about this new restriction of the COVID vaccine.
Doctors like Laura Blaisdell say they are left hanging with little understanding of the FDA's new COVID vaccine guidelines. What they do know is that soon the vaccine will not be readily available to many of their patients. Dr. Martin McCary, the commissioner of the FDA, and Dr. Vinayak Prasad, who oversees much of the research at the agency, detail the new FDA COVID vaccination framework. Under the new guidelines, only people ages 65 and older and others with certain risk factors will be able to receive COVID-19 vaccinations. People considered healthy and under the age of 65 will need to undergo substantial clinical trials with their physician or primary care provider before being approved to receive the vaccination. The FDA notes that these new adjustments allow them to, 1, prioritize high-risk populations, and 2, take an evidence-based approach when recommending COVID vaccinations.
I think what we're going to try to do is to lay out the pros and cons.
These changes come after years of RFK Jr. speaking out against vaccinations, saying some vaccines are not safe. Dr. Blaisdell says in science and medicine, it's common practice to reassess the use of prevention methods like vaccines to make sure they're the best option, but not like this.
I do think it's highly dangerous to politicize access to critical prevention like the COVID vaccine. I think ultimately these decisions need to be made between a physician and their patient.
Blaisdell says she fears that whether someone is considered healthy will become subjective, pointing out that patients who don't fit the script will be at a disadvantage.
We have not been communicated to as to whether or not we're going to have access to the vaccine, whether the vaccine will still be covered if we actually do prescribe it, or whether that cost is who's going to pay for that vaccine if it doesn't fall underneath these sort of very black and white recommendations. And as we know, medical care is anything but black and white.
In Portland, Raya Wooten, News Center Maine.
Another reason that this change is causing some concerns is instead of officially releasing the policy, the FDA's commissioner and director revealed the changes in an article published in the New England Journal of Medicine's opinion section. It includes a note saying, quote, "The views expressed in this article represent the policy position of the Food and Drug Administration," end quote.